We really saw teens and youth during COVID really impacted in terms of increased levels of anxiety, increased levels of stress, a lack of connection to their communities, to their peers. We saw a need for early intervention, prevention level mental health supports for youth who had anxiety in that mild to moderate range, where it was impacting their ability to work, get jobs, keep jobs, but it wasn't at that point where they could access. There were long wait lists or there was pay. So the Y developed Y Mind to fill that gap. So we're no cost, no referral, no diagnosis required mental health supports in that early intervention range. In 2017, started scaling that program provincially. And evaluating that, saw the benefit to youth, and we've always had Ys across Canada asking for the program, but we haven't had capacity to support them. And we saw those requests for help increasing over COVID as our youth became more anxious, as they became more isolated. We heard from Y associations coast to coast that they really wanted and needed the program. And the funding through Public Health Agency allows us to scale the program at a national level. So the YMIND program provides support to teens 13 to 18 and youth 18 to 30. It's a 7-week program where they learn the skills to manage their own anxiety, to cope with the stresses in their lives. Groups of 10 to 12 participants at a time. So also part of the secret sauce of the program is that connection of the youth to the youth, that they're hearing from others who are feeling the same ways. They think that they're the only ones, they're feeling very isolated, and they're hearing from other youth who are experiencing the exact same things about how it's impacting them. Part of the benefits of the programs and working within the Y Federation is really our connection to youth and our connection to community. There's less stigma attached for our youth into coming to a Y facility. We noticed that we had few Indigenous identifying youth that were participating in the program when we looked at the demographics. We did work with an Indigenous consultant and an Indigenous advisory provincially to develop mind medicine, and then reached out to different communities around BC. When we deliver mind medicine, it's always through an Indigenous serving organization. We don't deliver the program out of the Ys, although we have taken the learning from delivering and piloting in Indigenous communities back into the general program, so that any youth who comes into a Y-Mind or mind medicine program has that reduced stigma regardless of where they are. So we're seeing that impact on their mental health. We're hearing from them that they feel able to go to that job interview, to go out with their friends. So those types of impacts where youth decide, what their values are, how they want to live their lives, and have the skills and supports to do that.